Well, it's 3:59. We don't.
It's going right now. I'm starting it.
No, I usually turn around with. It's one.
Yep, we're good.
Good afternoon on this beautiful day. I will call our Health and Human Services regular committee meeting together on April 23rd here. Call to order, roll call, everybody is here. Affidavit of posting was posted accurately. We'll stand for a moment of silent prayer and the pledge of allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Right, any modifications to the minutes at all?
Other than all abstain since I was not present. I mean, in both.
No.
Oh, we don't.
Oh, yeah.
No.
No.
Seeing no,
And we'll accept it.
yeah, seeing no modifications, we'll consider them approved. So our first agenda item is the Children's Long-Term Support Corrective Action Plan. And Julie will help us with that.
Yes, good afternoon. So, if you recall, back in January, we presented, to this committee, the potential for this corrective action plan, and that we were going to be contracting with an external provider, Serona Recovery, to add case management positions, to the team so that we could, attempt to enroll more children and eliminate this wait list. We did receive a corrective action plan from Department of Health Services, and we did submit our plan to them within the timeline that they requested, and we have a meeting with them on May 8th to review our plan and for them to provide us a final approval of that this is our plan and this is what we'll be going off of. But because of that, I thought it was important to bring forth to this committee quarterly where we stand with our enrollment, because if there were some reason that we were unable to be to meet the outcomes of the plan that is agreed upon, there will be financial implications for our department. So I want to share with you where we stand. When we met in January, we had authorized and contracted with Serona Recovery to hire 2 case managers. They've hired 1. She started earlier this month. We filled our own vacancy on March 10th. They have made another offer to a case manager to start at the end of May. And then we authorized them to hire a 3rd position, just based on what we're seeing with the data. I actually did find out yesterday that they've made that offer. So currently all the positions that we're planning on at this point of bringing on board have an offer and have a start date if they haven't already started. Since January, if you look at the data, you can see we have enrolled 21 children, if I'm doing my mental math correctly. And so, but our wait list only went down by 5. So it is a significant concern to us, and we did write this in our corrective action plan report to the state that we can't seem to find the right number. Because as we enroll kids, they seem to come on to our wait list faster than, or just as fast as we're enrolling. But we do feel at this point, when we have all of our staff started and enrolling children, we'll have 14 FTEs. And at 35 children per caseload, we feel like we should be able to address this as long as the numbers just don't keep growing on the wait list. So I plan to come back to the committee in July after we've had our second quarter to be able to give you the data of where we're at with enrollment at that point in time. Yes.
So with the situation where as we service people more, the wait list seems to grow just as fast. When you meet with the state, are you gonna push for some caveats in this plan? So that if that trend were to continue, we're not penalized for that?
Yes, and I have a paper trail, when they first sent us the notification that we were going to be doing a corrective action plan, we had the ability to respond to that. And so I did send them a memo that indicated sort of all the efforts we've made in the last several years and gave them the data that we're seeing around no change in this wait list despite, you know, a significant increase in enrollment. We also put that into our corrective action plan, and then I will be at that meeting on May 8th and plan to address that with them and see what they say about that. I'm curious as well if, you know, if we're an outlier county or if other counties have experienced the same thing. When I've looked at the data of other counties, and they've all grown significantly in the numbers that they're serving, and many counties don't have a wait list. But I'm just curious at what they're seeing. Because even if you see, for the month of March, we had 11 children that were determined to be eligible, and in February, 10, right? I mean, that's a significant number, I think, for our county. So I am curious, and I think that, you know, is a quite well taken, that we're definitely making the efforts. And so, you know, how can we get penalized for something that we almost have no control over?
Right, thank you.
Supervisor Gallus.
Continuing that a little bit, so understanding that we're not unique compared to other counties, but do we have a handle what the root cause of those increase in cases or requests are, right? You know, so if you look to plan for the next 5 years or whatever the case is, instead of always being behind, you know, what's driving that?
Mhm. So there is a sort of a math equation that they've given us around the number of the estimated number of children in our county who could be eligible. And so that is part of the conversation I want to have with them is like, you know, what's the potential that we could project for? Anecdotally, we just hear a number of things. I hear a number of things from our staff around, first of all, obviously as there's awareness that this service is available. There are definitely families that are moving to Washington County. I don't know if it's for the services or the school districts, but it's not an uncommon thing that if you have a child with a special need and you want them in a school district that's supportive of that child, that parents will move to meet the needs of that child. So that is one data point that the staff have given me. And again, I think it's just general awareness that this service is available. Because I think prior to, you know, either people didn't know or they just thought that they would not get off the wait list. And so, and I mean, we think we provide a really great service. And so I think, you know, families, especially in the area of children with disability, you know, it tends to sometimes be a tight knit community and parents talk with one another.
So then knowing that that pattern is continuing, and then how do we get in front of it, right? So are we gonna, for example, in the next biennial, add additional FTE on either contract or employee side? You know, knowing that we may at least put it in the budget, and if we need to act upon it, we have that, or are we gonna come back, you know, to the board as need basis, like we have to?
Mm-hmm. So our plan is to add these 3 positions currently that we're contracting, because we don't want to create a county and non-county team. And so those 3 positions will be requested in the budget. That is a strategy question I will have for the BPA office when we have our preliminary budget meeting on whether or not we put in a position or 2. Because when you put it in the budget, you put it as an expense and then the revenue 100% offsets it because it is 100% of a billable position. And so whether the right strategy is to get the authorization, so to speak, for positions with the understanding we wouldn't fill them unless we needed to. So that is a conversation I plan on having with BPA, as well as our contractor provider. The benefit of working with someone like Serona is they can just, we give them the contract and authorization and they can just hire. It still takes them time just to like it takes us, right? We gave them authorization in January and it's April and we, have 3 accepted or one person started and 2 accepted offers. So it still does take time.
Great, thank you. And next, item is the opioid, settlement white paper.
So I think I just wanted to put this committee report together to start the conversation at the committee level. Now that we have successfully opened our sober living facility and been able to expend those funds or set up a contract for those funds, which were originally allocated from the opioid settlement dollars. And then we have used some of the funding for an assistant county attorney so that we can start our criminal justice coordinating council. And then we have decided to this committee's suggestion last month to fund our electronic health record upgrade with opioid settlement funds as well. So, but that's still puts us at a, right now, having receipted nearly $2 million in settlement funds. And as you look at the report that's attached to this, you can see what's projected for us to be receiving through 2038. And so, our next steps then are to put together some proposals on how we might use this funding and then bring it to this committee. There's some potential opportunities that we have discussed internally. In the last week, there also was a notification that went out from an organization called Vital Strategies that they are willing that we could write a grant where they would match up to $100,000 of opioid settlement money if we use it on some very specific things. And so we have an internal meeting with my team in the next week to talk about some of those strategies and if they're viable for our county and if there's a need. And so these are some ideas. Certainly, we're looking for other ideas on how we might utilize this money. We're also always balancing the ability to meet a need in the community, but also know that, the funding is only, well, I shouldn't say only through 2038, because that seems like a long time, but in 2038, the money will be gone. So anything that we do, needs to have at some point become self-sustainable.
That's always the challenge.
Mm-hmm. And I might not be here in 2038, so maybe that's someone else's issue to deal with.
I think the one point I would make is things don't necessarily need to become self-sustainable. They can be things that we can in 2038 if the need isn't there any longer, or if the need is reduced.
I think that's a very good point, and I think, as we've been having some strategy discussions internally, when we signed on to the settlement dollars in 2017, there was very little services being provided to impact the opioid epidemic. And since that time, we have implemented and received other grant funding for a number of services that meet the community's needs. And so where we were 8 years ago is a different place than we are now. And so, that's a point well taken. Thank you.
Are you implying those grants, state or federal, whatever, that they're likely to continue?
So some of the work, so drug treatment court and our diversion programs as an example, right? Those are things that we were able to start up with other dollars. Drug treatment court is one of my number one priorities in thinking about how to continue the funding of that. And as indicated in the report, that does end September of 2027, and we're unlikely gonna be competitive for a third round of funding. So, that is something that, we have to keep our eye on. Some of the other things, some fund, like we have our medication assisted treatment program, out of the jail where people get, they get medication prior to release from jail so that they don't have, those cravings to go use. And that is funding we receive from the state, but it's, general purpose revenue funding, so it's in the highest likelihood to continue, versus other grant dollars. And then we do receive some state opioid response funding that we've received for the last 6 years. That is from the federal government, so, again, and it was reduced this year. So, those services are also something that, if something changed with our grant funding, we would want to continue in some form or fashion. So you're kind of, doing the balancing act between, wanting to support and meet other needs in the community with this money we have, but also know that the work that we're doing right now has been very impactful and, we want to be able to continue that.
I saw something just the other day that Walgreens settled for more money. Into the millions. I can't quote the amount, but should we be expecting more from them then as well?
I'm not really in tuned into all the different folks that are under this lawsuit, but right, every time there is a settlement like that, because we're signed on, we're very likely to get something. So that is correct in that we could get more money in the future, or this could, the dollar amount could grow. If I believe that the 2038 is still sort of the date that's been put out there. But I suppose it all depends on what litigation is happening at this point in time. We essentially just get usually a notification that there's a new, a new settlement, and here's Washington County's allocation.
Okay.
So do you mind going to the county payments? 2022 through 2038. So we have roughly through 2025 here, we'll have $2.5 million, a little bit more, 2.6, 2.7.
We have received over $3 million and we've expended about 1.1 million. So right now we're sitting at about 1.9 million that we've received.
And that's already been accounted for. So you said the unaccounted is 1 point something?
So the 1.1 has been spent and we have about 1.9. But then if you look at, so as an example, what's expected for, we have not received a payment for 2025. So we're expected to receive a payment of 439. And then in 2026, we're expected to receive a payment of 532,832. Sometimes what has happened is that they have also prepaid. So you'll see sometimes it's where the zeros are, like sometimes people prepay yours. We don't know what that's all about, but we just receive the funding. And so this interactive tool that WCA and Forward Analytics has put together has been something for counties to be able to try to plan for, right? Because it has been a bit of a moving target.
Right. So I guess I'm just trying to understand if we have 1.9 unallocated, correct? And each year we're gonna be getting from 4 to 5, 6, and then it tapers down to less and less, less than $250,000 for the last 5 years or so. What is there a constraints on when that, so if that 1.9 sits for a year and we don't spend it, is that an issue or concern? And then I think more importantly is how do we spend it, right? If it's available to us, how do we help the community? And, so are we holding ourselves accountable that, look, that 1.9, we need to allocate by X period of time?
There has not been any guidance that has said that you have to allocate it by a certain period of time. It doesn't preclude our county from determining that, setting that parameter, but there has been no parameters. We do have to report on what we've spent every quarter, and then what we've spent it on. I know that, based on a recent report I received, I think many counties are in the same boat that we are in, is that they've spent some, but they haven't either allocated all of it or they haven't spent, what they've received so far. And I know, and I think it's always the balancing of, we want to make sure that the money is spent in the best way in the community. But we also don't want to let it burn a hole in our pocket. Which is why, this conversation at this committee, I think, is important. And then as if we bring ideas forward to this committee, around how we think that we should spend that money. Because it has to be approved to the committee and the county board on, the next iteration of allocation. I just want to make sure I feel like I answered your question.
Yeah, you have, so the potential opportunities in here, are each of those 5 or 6 items, being vetted, what it would mean, to your point is, we don't want to necessarily, although I do agree with Supervisor Bossert, just because we do something today, doesn't mean we have to continue funding it. However, if it's an employee and it's providing service, well, then we're kind of locked into that. But if it's enhancing a program or maybe getting a startup, whatever, build out a $1 million building, whatever, and it's in play now. Now you're on your own. You guys find out how to continue funding it. So are these, 6 or so items, being vetted for the likelihood of success, what the cost would be?
Yes, so I mean, these are some potential opportunities that we're having discussions about and putting together some plans and determining, right, what's the feasibility, what can we do with it? I hear all of the time around various things from my staff about need, but sometimes we can't always put the what to it, right? There's definitely need in child welfare. I have had a conversation with our initial assessment supervisor. She's really excited about some opportunities that she has ideas around. Our outpatient clinic services supervisor has some ideas around more intensive substance use disorder treatment that could be provided out of our building. So there's ideas that are happening that we're having conversations about, and so I guess this report or this committee report is just essentially the beginning introductory to this committee around, we will be coming with ideas and thoughts and want you to sort of start thinking about that as well.
And one last thought, with our ongoing shared services that the county is doing. So from Washington County Health Services and school districts or other municipalities, are there any opportunities for shared services that those dollars could augment or help build up a program, even though that it's limited funding?
That I'm not sure. I will say that we're still in the cycle of the ARPA funding that we put out to our community-based organizations and some of our schools, where they're providing increased mental health and substance use services. And so that goes through 2026. And so another thought is, if we have had a program that's been very successful, would we want to continue that? And so, to be honest with you, the opportunities are limitless in some ways. And so we have to sort of really, it seems like a lot of money, but I think we all know it goes pretty fast.
So to build on the conversation, Julie, two-part question. So the accountability that you have in the reporting, I think you said quarterly, to them, how much we've spent and where we've spent it. Are there outcomes, is it an outcomes-based accountability in there from the state level or from wherever this is being managed?
No, and from my understanding, the way the tracking is just to have some accountability and transparency that these funds are actually being spent on mitigation support versus, putting new carpeting in our building or something like that. So they're not, it's not like a grant because it's really our money, we signed on to the lawsuit. And so, it's not like a grant where we have to say, prove, that what we did had some, measurable impact. But we have to just indicate how much money we spent and what categories. There's like a number of categories that are authorized to be spent on. And some of them are vague, right? And probably intentionally so, but then to say, well, where does this fit in? Right, so as an example, we did make the decision to use some of the money for the behavioral health, electronic health record upgrade. And you make the connection to that around, we're providing substance use services out of our division, mental health services out of our division. And so, we need to track that and build that. And so that's a good connection. Versus I'd have a hard time, making the connection between new carpeting. So.
Sure.
Even though, it still supports our office.
All right, well, thank you very much. I was just curious and that explains it very well.
Sure.
Any other questions, thoughts about the opioid? Okay, thank you, Julie. Moving on to our last item, the Riverbend presentation. So I'll give it to you, Julie. If you guys are like me, I wasn't even aware of Riverbend until I got the report and been talking with Julie about the agenda and stuff. It was like, okay, time to figure this out, find out what this is and what it is and what we're gonna do.
Yeah, so thank you. So this again today is to introduce you to this service, and to talk with you guys about, the challenges we're having with this service. And to sort of start the conversation that I think will be throughout the rest of this year around what do we do? This was one of the strategic priorities that was sort of discussed at your retreat, but I don't think it was pulled apart in any depth. It was kind of like, do we want to pay attention to this? Whether it made it on the strategic priorities, I'm not sure, but we do have to pay attention to it. So I'm gonna have Coral walk you through the report, just so you can have an understanding of what you're looking at and what the numbers mean. And then we're gonna then talk about sort of what the issue at hand is. And then I'll ask Coral too to sort of give an overview of what Riverbend Place is and who it serves.
Good afternoon. Riverbend Place, also formerly known as the Washington County Youth Treatment Center, or YTC. Supervisor Boster, you may remember this from some time ago. It has been around since 1996. It was created to take the place of two juvenile group homes that were in West Bend for kids who needed to live outside the home, and needed community-based treatment. Riverbend, or I'm gonna refer to it as Riverbend, as that's how we know it now. Riverbend provides two services. It provides residential treatment, so I say inpatient because the kids do live there and they receive clinical services there. But the unique part about Riverbend that is different than the residentials that I presented on a couple months ago is that these kids continue to go to their home schools. So if the child is enrolled in Hartford, they will live at Riverbend, they will do their programming there, and then they will be bused to Hartford every day, do their school programming as kids do, and come back. That has always been a unique piece of this program, and something since the beginning, since I've been here 7 years ago, and when we went through, which I'm sure we'll talk about later, we went through our RFP in 2019, that was a really important piece of this program. The other program that Riverbend provides is shelter. So that is a temporary placement for kids who need to be placed outside of the home, via court order as well. That could be kids who are ordered by a judge to be placed outside the home temporarily, or kids who are awaiting perhaps a longer term placement. Shelter is statutorily no longer than 60 days. So you get 30 days up front and you can get another 30-day extension. And our residential program there is meant to be 6 to 9 months, probably closer to 6 months. And we'll go through the report, and that's actually been a pretty good indicator for us. No, we looked up one piece, so I can report, yeah, alright, I will jump into the report. And try to just provide some context for the numbers, of course, happy to take questions, I won't read through everything, but. At least enough so you know that we're, what you're looking at, and so we can have a really robust conversation either tonight or, as Julie mentioned, as the year goes on. So just to put some context, Riverbend Place operates, at, 10 beds, that is what they would consider full. They can have up to 12 beds. There's technically up to 14, but 12 beds is sort of like the max there, and one of the rooms no longer meets licensing requirements. So it runs full at 10 beds. And at any given time, it can have kids that are in the residential program and kids that are in the shelter program. So those two programs run simultaneously. So if you look at the first graph here, this is group care average census by year, broken up into, so Washington County residential, so the red there, those would be the kids specifically from our county, kids that come through my division. The green being out of county, or sorry, the blue being out of county residential. One of the things that was important to us as we did this program was having out of county kids available to help with our budget and with our maintaining this program. I've said a couple of times that I've been here, Washington County is a big county. We have a lot of need for services, but there's times where we're not that big and we cannot keep kids enough kids to keep a program always going, right? So marketing out of county kids, there's a huge need for out of home placements in Wisconsin, which we've talked about, so that helps to offset costs. And then green is the shelter care. So as you can see, we did not meet our 2 county beds. That's what we had asked Norris for, was to have 2 kids at any given time from out of county in the bed. And also our annual census was way below 6 beds, so that would be again the red column. Admissions by year, I want to explain admissions because admissions for residential and admissions for shelter are a little bit different. So admissions for residential are really total kids served. Okay, so this is group care admissions by year. Shelter care services are shelter episodes. Like I said, that program is 30 to 60 days, but there are kids that go in and out of that program regularly. So while admissions are total kids served, the shelter care admissions in the green column there are number of placement episodes. So, but one kid might have 3 placement episodes, but that's how many admissions for the year. As you can see, our need for shelter continues to rise, and our residential beds have gone down. Moving on to page 2. Median months in care, the first graph there. Like I said, residential is meant to be about 6 to 9 months, although 6.5, where we are kind of in this program, is a really great place to be. We don't want kids to linger in residential care. I've always attributed to this for the community-based pieces of this program. So like I said, kids stay connected to their home schools, their communities, parents are close. They're able to come to the facility for visits or family therapy, or kids can go home on the weekends and come back very easily, work on those skills that they're working on in therapy, and really keep those connections. We've got kids up north and in La Crosse or Ashland, places like that. It's much harder, of course, to facilitate those family connections. So that's one thing that has really been great about having a program right here in Washington County, is to keep those families connected. As well as the median days here in care, the second graph on page 2 is for shelter. We say we're about 30 days, but you can also see that has increased over time from about half that, about 15 days. And I would really attribute to that kids waiting for other placements. They're kind of like stuck at shelter while we wait for a placement where they can go, if they can go home, or if the court has ordered them to shelter for a period of time. that would also attribute to that. But mostly I would say that those complex kids, the higher needs kids, they just sit and wait at shelter for a residential placement that can meet their needs, which isn't always staying at Riverbend. We go on to page 3. The top of page 3 is shelter you previously served. So I mean, that's just around kids who you know, come in and out of the program. I thought this was very interesting that 22% of those youth have been previously served by shelter residential services. We would expect to see that. We don't really contract with any other shelter programs. So our kids, if they need to come into care or need a temporary placement for whatever reason, they get arrested or they are unable to find a placement for them, this is where they go. The last graph here on page 3 really talks around just discharges to residential treatment. That would make sense in terms of, you know, a lot of times kids start at our shelter and then we'll transition to residential services if something else is not available to them. Page 4, discharges. The last 2 graphs there are data that is required by residential facilities to report to the Department of Children and Families. Used to be on a public dashboard, but my understanding is it no longer is. You can kind of see on the bottom there, the definitions for, you know, optimal, favorable, very favorable, et cetera, that really doesn't have any kind of impact on what we do. What we did like about the public dashboard is you could kind of see what the ratings were for the various programs across the state. It's just a nice handout of information for us. Skip that blank page, and then I think 6 is very interesting, page 6, and then on page 7. So page 6, annual incidents requiring law enforcement. One of Norris's program values is really not engaging with law enforcement unless they absolutely have to. You know, they train staff to be able to do verbal de-escalation with kids when they are in a crisis. They do have also training to do hands-on holds, calling restraints and calling holds. Kids are really escalated and they're a danger to themselves or others. But there are unfortunately times that require West Bend PD to respond. And so that's what you were seeing here. I do know there's an outlier, right, in 2022. I do know that 2022, we had quite a million little kids there that just did not gel with each other. So there was a lot of law enforcement contact. I think also another thing that I think shows or contributes to increase in law enforcement contact is newer staff, right? Even though staff are trained, we've got kids who have a lot of mental health needs, high needs, behavioral needs, and you know, some staff are better skilled to handle kids in a crisis, and will try to handle it on their own, or you know, be able to stick with it, and others, you know, sometimes call the police a little sooner than you should. So I think that's what explains those numbers in terms of increases in contact. Yeah.
Excuse me, I have a question about that. Now that we have the co-rides with the social workers and the police officers, the sheriff, the deputies. Do you think would this be a proper place for them to go and respond to the police needed kind of contact? Or is that not appropriate for them to go to?
I think it gets complicated. I know that they have been engaged with the crew team, but because West Bend has to be the responding department, then they would have to call in the co-responder team to that situation. I know also that Riverbend has a good relationship with our crisis services, so they do try to engage them first as well. Because ideally we don't want law enforcement called out for a number of reasons, but also as you can see, then many of these kids who are already sometimes in a bit of trouble, and involved in the criminal justice system are then getting another ticket on top of it. Right, which is not what we want, is not what we're looking for, but that is then it's at the discretion of the officer on how to handle the disposition of that case.
Thank you, makes sense.
Right, and then good segue, that second graph on that page is around, law enforcement involved is really the disposition of what those, incidents, become. And, you know, it doesn't really equal up to the amount of, contacts, but at least it gives it kind of an overview. I would say the majority, we have a really good relationship with West Bend PD, and, you know, they really try to work with us with our kids. So, I'd say most times it's either a ticket or return to Riverbend. The last page is serious incident reports. I just kind of want to talk about what some serious incident reports are. Serious incident reports are required, incidents or events that are required by statute for the residential facility and shelter facility to report back to the Department of Children and Families. They can be anything from if a youth discloses child abuse or neglect in a therapy session, they have to make a report. If there's a child abuse or neglect allegation on the staff of the facility, they have to make a report. Not only they're reporting to, you know, access line, but they also have to report that to the state. Any suicide attempts, any incidents that require law enforcement, any serious injuries of kids, medication errors by the agency, things like that. Those are required to be reported back to DCF. And this last one here, total incidents involving restraint. Restraint is what I was talking about. It's a physical hold. Wisconsin, at least these particular types of residentials do not use. So these are 2-person holds restraints, not like a physical restraint. So this isn't like straight jacket or anything like that, or maybe sort of the apron that they'll put on you in jail. That's not this. We cannot do that in Wisconsin. It is a 2-person, for the most part, 2-person hold for the safety of the child. So that's what restraint means here. And how it's defined here for residential treatment facilities.
Okay, so you're probably asking, well, what does this all mean, right? So the crux of the issue that we're having is, you know, I think historically, at least in the tenure of Coral and my time here, prior to us putting this out for RFP, the facility had low admissions. And if you can imagine, we're paying for this facility no matter what, but then we're still sending kids out somewhere else. So if they can't go to this facility, then they're going somewhere else. We're essentially paying for them twice. So we put this out to RFP because we, you know, wanted to have different outcomes and have an improved service, but still had desire to see if we could maintain a residential service in the community where kids could still be connected to their community, to their school, have easier access to their parents. We issued this RFP in 2019. It was awarded to Norris in 2020. Of course, we all know what happened in 2020, so it was a little bit of a rough patch getting that up off the ground, but they did a great job, even with all of the impacts of the requirements around the pandemic. So they opened in 2020, and I would say since that time, it's been a bit of a roller coaster around staffing and their ability to maintain staff, which impacts their ability to take admissions. They've had a number of leadership positions turn over. Some of that, right, is, I mean, we all saw it in 2022, where everybody was what they call the great resignation, when everybody was leaving their jobs and getting paid to all sorts of money to do a lot of things. So we all saw that, and we did acknowledge that and understand that for them. However, this is a unique facility in that we're trying to do 2 services in the building. And so because we're trying to provide residential, that comes with a level of therapeutic intervention that requires more staff and higher level of education or certification. And so the cost of the facility is really designed around a residential placement facility. Whereas shelter has different requirements and would have a different cost if it was just a shelter. And so if you see here, on any given year, we're serving on average 5 or 6 kids all year in residential. And the need is very great and growing for shelter. And so this question, right, around are we getting a good ROI? Coral referenced that we have the capability to have 10 kids or 10 beds. On any given day, there's 2 to 3 kids, sometimes 1. And so, but yet you still have to staff for as if there might be, 5 or 6 or 7 kids. So in the fall of 2023 in October, after Norris had approached us around the way that we contract with them, we had a discussion. So we previously contracted with them with a flat amount. The RFP issued said, this is the amount that's available to you. And then, let's figure out what your costs are and how you can meet those costs. And so, that's where the Allen County that's come into play. And when they submitted their original proposal to us, it included those out-of-county beds to meet their total cost. Now, they've had a change in leadership, and their board and they've not been able to also have not been able to consistently fill the out-of-county beds. Their board, as I'm sure you guys would say to us if we weren't getting paid what we should for something, really pressured them to request that the county pay for the full cost of care, and then offset it with out-of-county beds instead of the other way around. So we agreed to that in 2024, and then in 2025, this continued. That was part of our carryover request because the increase is almost nearly $500,000 from where we started in 2020. So the question, right, is are we getting the return on investment that we need? In our meeting with Norris, we talked about the low admissions and the high cost. And they proposed a concept and an innovation to us around a 90-day assessment center that we thought was very much innovative, very much met a need in the state that does not exist. And to not go into great detail, a 90-day assessment center essentially provides us the opportunity to get full assessments of kids and to provide some therapeutic intervention. So we have a really true good understanding of what they need. And then we very likely could wrap community supports around them rather than sending them to a facility or a residential placement. So we thought it was a great idea and wanted to give it a shot. We've spent all of 2024 doing the planning and implementation, and they were to go live with this on January 1. They've had staff turnover, they've had difficulty filling certain positions, and they requested to delay until April 1. And then we got the request to start on May 1st, which, as we all know, is like a week from now, right? A week and a half. So as of today, we have a belief that they're ready to go May 1st. But it also we don't believe that we can fill all of those beds for a 90-day assessment center. It's really also still hinged on other counties utilizing this service. We still, no matter what we do, have a need for shelter. And so the question for us is, if they're not successful, right, we were in a contract with them, we want to give them the opportunity to do what they said they were going to do with the start date of May 1st. But if we're not successful, is the next steps for us to look at issuing an RFP just for shelter and not doing residential. But then if we do that, we don't need a 14-bed facility that's next to the Samaritan. So then we're talking about then needing to invest money into somebody purchasing a home or renting a home or something like that, sort of think group care, group home type of placement. And so that's where we stand today around trying to make those decisions, but certainly don't want to make decisions without this committee's input, and also knowing that if we go down the road and want to make a big ask, you have to know what's going on. So that's a lot of information, and I will stop there. And it won't be the last time we have this conversation.
All right, any thoughts at first before?
Well, so thank you for, framing up the situation. And, there's a part of my brain that looks at it quantitatively and then qualitatively. And you framed up the quantitative part as, look, are we getting the money's worth out of it? It's an underutilized facility. We got staff standing on literally doing nothing because there's not beds filled or some level or degree of that. So is the $1 million+ being best utilized? Could some of those additional dollars that we can put into, and this is my words, lift up Norris Inc., right? Could those have been used elsewhere in your department? So that's the other part that I'm thinking about is, so what has been the takeaway, right? If we diverted funds from some other area with the finance budget to this, and it's not materializing, how long do we do that? So I think that you're asking, or maybe you're not asking this, but to talk about it, how long do we go down this path? The deadlines have come and gone with this 90-day center. How likely is it to open on May 1? Sounds like little. And then even if it does, is it going to incur issues? So the qualitative part of it I'm thinking about is, what are the needs of the community? And I think I heard you say that a shelter is much greater need than residential, because there are options in place residentially, but to do a shelter, short term and put them way far away is detrimental to all parties. So how then do you focus on a sheltering part of it and maybe sidestep the residential and see if there's a market for that in the future, for lack of a better word?
Yeah, I mean, I think you hit exactly the conversations and the struggle that we are at, right? How long, right? And we've been saying this for a number of years. Coral will attest to this every time we talk. If you say, first it was youth treatment center wasn't operating and meeting our needs the way that we wanted, so we did something different, right? We issued an RFP and went with a new vendor, and then it was the pandemic. Okay, gave them a pass on that. Then it was a hiring issue. Okay, give you a pass on that. And it starts to feel, to be honest with you, semi-ridiculous on our part, right? Because now we're talking about 5 years or going on 6 years of, it's not that they're not providing a great service to the kids that are there. It's that the either the need is not there, or they can't meet the needs of our kids, because there are kids that can't go there, right? Because the complexity of their need is so great that they can't, they're not equipped to provide that type of service. And one of the other data metrics that we also do look at is, because prior to going to the opening with Norris, we were seeing a lot of kids go to our in-county residential and then having to go to another residential. Right, so they weren't getting the intervention that they needed to go back to the community. They were having to go to another, institutional facility. And so I think we've seen some improvement on that, but it certainly still does happen, right? That we've had to then send a kid to another location.
Less so.
Yeah, less so than prior to this new provider. But so I say all that to say, like, that is the 100%. The struggle and the place that we're at as well. And do we make that tough decision and invest into just shelter? Because I think if we went to the point of just shelter, there would need to be an investment upfront to do that. But then I think that we would see an impact, later on.
Do we have a question on, you also said that since 2020, the cost went up $500,000, so $500,000. Is that broken down somewhere? Is that going to continue to go up?
And my costs go up every year. I can imagine. That is, so, and right now the contract they have is based on this 90-day assessment center, right? And so right now they are trending to be $200,000 underspent because they haven't opened yet. But it's still $300,000 or $400,000 or, $350,000 more than, what we had contracted with them before. So I've seen it with every contract that we've had, right? They usually typically want to have a 2 to 4% increase every year. And so, so it's very likely it could go up, right?
And to help us understand, we get the idea, I think, in general of residential, where they're there, you've described that before and a couple months ago. The 90-day assessment center being more of the, short term but just for our help, they would still stay there for the 90 days, they would be residential for that 90 days. Be involved in their own schools, no.
No,
Okay.
that will be a big change for this program comparatively to the other programs. For the 90-day program, you may know that there's Norris School District, it's the smallest school district in the state. So they run, it's separate from Norris Inc. Norris also has a school district. And then so they have a second campus down in McGuanago, and Norris School District runs the schooling for the boys who stay there. So what part of this program is they're gonna have a teacher, an educator up here, or someone in that para role at the very least, to be able to help if they're in our program. Staff with their school be enrolled more than likely in the Norris virtual school, and that person will also coordinate with the home schools. Because it's 90 days, it's a pretty long time, but not really long enough. And a piece of this program is just continued clinical intervention throughout the day. We call it microdosing. So these kids are gonna be just practicing these skills and getting these interventions and going to groups, and like this is happening all day long. And we thought taking them out of the school and missing that or out of the building to go to school they're gonna miss a huge chunk of time. And we want to sort of, I don't wanna use the word isolate, but we wanna keep these kids insulated to be able to receive those clinical services, because we only have 90 days. They're getting assessments and testing done, as well as some introduction for different therapeutic interventions. And we really thought to maximize our time that we really need to keep them at the building. We'll be able to do outings and things like that, but in terms of the school piece, it'll be in the building.
Julie, you had mentioned there would be a ramp up cost if we're to focus on the sheltering and not on the residential. Is that to create or implied more beds, for lack of a better word?
No, so it would be from our standpoint and the conversation we've had internally, is if we went to just a shelter facility, we don't need a 14-bed facility there. So, we could close that facility down.
Bricks and mortar.
Right, we could close that facility down, sell it. But then we would need some level of investment to help a provider either purchase a building, rent a building, something like that. But it's all also predicated on issuing an RFP and finding a provider who wants to do that type of service as well.
Okay.
Yeah.
Picture, just sort of put it in perspective, just a piece of information while we have this conversation. A lot of counties don't have their own shelter. And that could possibly be on the table, but those kids are then placed, so, like say, Winnebago County, has a shelter, so that's Oshkosh, right? So every time that child has to go to court, sheriff's department or someone's gonna have to go up there and bring them down. They're going to be taken out of their schools, things like that. There's a lot of additional costs with transportation and getting kids back down here for whatever they need to be doing, displacing them out of their school, having just disruption to their treatment, things like that. So it's actually it's a huge benefit for our kids to have a place here in Washington County that we can use temporarily for them. Otherwise, we are just taking them and replacing them far away. If they're down in Milwaukee or Oshkosh, I don't remember if Fond du Lac has one, Sheboygan has one, things like that. They'll just be scattered everywhere. So if we just think about costs, we would have to figure out how to get them back for the regular court appearances and things like that.
Sorry, just trying to wrap my head, I fully get the residential and that part, but so in 2023, they're discharged. Make sure I look at the right. Here we go, shelter care service, 2023, there's 30 throughout the year, so what is that, what does that actually mean that? With those
30 kids.
30 kids that spend some time in some sheltering capacity. What does that actually mean?
Those, that's already in that green column, those are the kids that came in through shelter only programs, so no clinical services. They were admitted because they were removed for either they got arrested and couldn't go home, or by the court to leave the home. Or if they were, youth that came in on a child abuse or neglect situation. It's 12 or older in shelter, we run foster homes for kids under 12.
So that 12-year-old that came to us, they slept in a bed, one of those open beds for some number of nights.
Correct, up to 60 days, yeah.
So if we'd still need either our own facility or rented or whatever, or some other facility that have sleeping quarters and bathrooms, etc., whether it be sheltering or whether it be residential, but the sheltering is for a shorter period of time, whereas it was there residential is for a longer period of time.
Correct, and residential comes with the other pieces around clinical programming, where shelter actually you can offer groups and programming, but it is not required. So the licensing pieces are very different, which is why every bed at Riverbend is actually licensed as a residential bed.
And so, some of our modeling around, if you look at 23, 24, 30 to 25 different admissions, and on average, they stay around 30 days. We think we probably need 4 to 6 beds at any given time for shelter. That would probably, which is half, right? More than half of what Riverbend currently has.
Do we own Riverbend now?
So we own Riverbend, yes, and we provide the maintenance and the upkeep to that building.
Other questions or ideas, thoughts as we process? Thank you very much for getting us up to speed, and what do you see as next steps?
So yeah, our next steps, we're committed to, we're in a contract with Norris. We're committed to try to see where this 90-day assessment center goes. Again, we're delayed now by 5 months. So I want to see what happens in the next 3 months. And then, report back to this committee. We live on hope against hope, right? On paper, looks like a really great idea. And really innovative. And so, we'd love to come back and tell you it's a smashing success, and just kidding, we don't have any problems. But so far, I'll be honest, we haven't felt that way, for the last several years. And so, if we come back in the next quarter and report, something different than, a smashing success, then I think we'll have to have a further conversation around what this means and what we should do. Because anything that we do differently is a process, right? You have to issue an RFP, you have to award an RFP, you have to find a location, you have to license that location. And I know when we shut down for 6 months in between relicensing from the old provider to the new provider, our law enforcement partners and some other partners in the community were very nervous, because specifically the shelter beds, are a great resource for them, and for our crisis team in the middle of the night when you have a kid who needs placement and everyone else is sleeping. It's a great resource. So, and there's that change in the community as well, with our community partners. So I think there's lots to talk about.
I have one question. What's the difference between this shelter and foster care?
this shelter is a 24/7, 365 facility. Where we use foster care, I usually use it as my family base, like in someone's house. So technically, it's all foster care, but when we think of foster care, we think of like living in a family setting, and this is like a facility setting, it's like a dormitory setting, what it looks like.
So are there not enough families, or they break with families rather than?
We always try to, so if say some kind of incident happens, right, and then it's in their house. We always try to look for family or family friends first, especially if it's in the middle of the night, some people just need time to cool off, a little separation. But sometimes those folks don't exist, or those families have burned bridges with their extended family or friends or neighbors. So those kids need a place to sleep, and that's where they have to go. We always try to keep kids with family, or in a family setting before moving to a facility, and it goes for any of our programs.
But in some cases, they're not necessarily under CHIPS order, right, where they need a foster placement.
Yeah, so some kids, they're under,
Mhm.
yeah, most of these kids are, when they're going to shelter, an incident has just occurred, right? They just got arrested, they've gotten charges, so really those kids aren't under any kind of court order, and just a foster home does not, does not fit their current situation, let's say. Yeah.
So, Julie, you made some intimations, but it's curious, what does Norris Inc. say? I mean, how committed are they to this contract and agreement, and
So I mean, verbally, they've said they're very committed. I have had a very frank conversation with their executive director around this issue. Coral has ongoing conversations with their program manager, and so they have been committed verbally, and they're doing some work and some efforts. Some of it is behind, having to hire the, people into the positions, and that takes time. But they're not driving it as hard as I would like, to be honest. But they are committed. I mean, when they presented us with this project, I mean, they're very excited about it. This could be really, really great, right? But somebody has to, and this is not our area of expertise, or maybe we'd be sitting in front of you asking if we could run it. But I don't know if Coral would like that, but so, that they are, they have the expertise in this area, and they know how they do this, right? And so, I know that they would not be interested in not continuing, but, we've had some great conversations.
Well, as we sit here, you could get a call from them next week and they could say they're not ready yet for May 1st.
We certainly could, but all of the information on our new program has gone out statewide. Their former chief operating officer and I went to all of the regional child welfare supervisors meetings between Q4 of last year and Q1 of this year. So like the cat is out of the bag. We have been out there on the pavement, talking about it, answering questions, hyping it up, if you will. And that stuff has gone, the materials have gone out. So
That's a good sign then.
That is a good sign, I
Different
think.
from when they
Yeah.
couldn't open before, that you didn't get that far.
Right. But all that work has been done, and I mean, I can think of my counterparts and colleagues across the state, if this came across my desk or in my email box, I would want to know instantly. Especially, this program is similar to when I talked about a couple months ago, called Northwest Passage. It's a assessment program. Kind of, it's like as far as Ashland, but it's 5 hours from here. And we send a good number of kids through there. It's very expensive. It's like $900 a day, short-term assessment kind of thing. Those kids are so far away, and it's so hard to get parents up there and keeping those connections, that having something for southeastern Wisconsin is actually awesome. And I just think it would be really great. This works, and that's why we both think so they hold on, because I really like our kids to be able to be served here. And then to be able to be discharged into community programs, all the ones we talked about, the CLTS, the CCS, the FCT, the whole alphabet. about the stuff that we're already doing, like those kids, those families need to go into our programs here. Not be sent away, so that's why we're really crossing our fingers and toes that this goes well.
Are we paying them now?
For this contract,
Yes.
Yeah.
Yes, we have kids there now, so we do pay them.
But they're gonna start a new program May 1st.
They'll still do shelter, however, so.
the program is under their current license. So it's really just sort of like moving their clinical folks around and kind of like restructuring their day and what the kids, like what it would look like. It isn't a huge change from what they're currently doing.
And
Excuse me, Mr. Chairman. Sorry.
And presumably that will bring in more out of county and more self-sustaining dollars, for lack of a better word.
Yeah, so I mean, when I've done the way that I've set up the modeling for their contract, or for the funding of this is, there's a certain number about a county for a certain number of days that covers that extra $500,000, right? On paper, right? So it does, it would cover it, and this wouldn't be this issue of $500,000 increase for a program for 5 of our kids. But it all is predicated on them marketing this program and then having other counties send their kids here. And then, obviously having the outcomes that we hope to see, and then it's like the same thing as any good restaurant, right? And then people hear about it and the good outcomes, and then they utilize it. And so, but we have to start, and we have to see where the next, couple of months go to even see what the interest is from other counties.
Is the contract on the calendar year or fiscal? Okay, so the contract would end at the end of 2025?
Yeah.
Okay.
And we usually typically start doing, well, this year it'll be as soon as the budget's approved, we start doing contracting, but we typically have started doing contracting in the fall, just because it's a lot of work and I want to get that done. But we'll also start doing budget conversations in the next couple of weeks, and so, thinking about that as well. I don't think we'll be able to do anything different with our budget in this next biennium. Because any big decision will have to be made will be probably happening in the middle of the budget.
The only other last question that I would have, if anyone else has any on this topic, would be, is it worthy of any kind of brief ad hoc committee or task force to just kind of look at, you had mentioned what other counties, the idea of marketing of it is it worthy of that, or is that too big of an issue or a big of a solution to?
I don't know if I can answer that. I would say I think there's probably merit in it, and then there's probably the downside of it as well. I think the question maybe is, especially for this committee to make a decision, when we come forward with you with, okay, this continues to be a problem, we have to make a big decision. What kind of information do you need to make that decision? And so then is that there where, a group could, a specific group could come and bring, put that stuff together for you. And certainly it could just be an internal committee, and, maybe chaired by somebody, externally, but I think, I'd like to maybe see if we can come back in 90 days and see where we're at, right? And we are doing some concurrent planning internally as well, just maybe putting some of our thoughts to paper and things like that.
As much. Is it possible to, I know we will discuss it in 90 days, could you give us an update in our main meeting, just to see if it actually?
Sure, I'll give you a brief update.
I'm really curious now.
Yeah, for sure.
Again, assuming good intent and hoping this materializes, both there's a need and they know what they're doing, so it does take off, and maybe it's slow to start with, but let's assume fast forward 12 months, and we're still talking about this underutilization. what is that potential exit strategy, even if that's temporary, because you said that RFP process is long and cumbersome. So do you exit, close the facility, go through an RFP, and then that's a 6-month process, and then you reopen a facility, et cetera. So I'm assuming you have some thoughts of what a timeline might be if a recommendation or this committee recommended to the board that, you know, what, we pause or suspend the shelter or residential services for next period of time.
Yeah, I mean, I think, if we went down the road of not trying to have an overlap, right? Which I think where our brains have been around trying to, if we would try to do it in a way that, you know, we could have something open and closing, you know, River Bend at the same time. But if we said, no, we just have to, you know, it's been another 12 months and we have to cut our losses and then go down this other path. We would just need to do some really intense internal planning around and communication with our community partners around where we're gonna send these kids and for how long. Which is what we did when we had to close down in between opening one license and another closing a license and opening another license. I think that was about 6 months.
I have that experience, which is good.
Mhm.
Any other questions, comments? Right, thank you for that great information. Thank you. Our next meeting date will be May 28th, and this meeting is adjourned.